For arterial blood gas analysis, you have to get some sample from the arterial blood. Commonest site is radial artery, other sites is brachial artery, femoral artery, arterial dorsal species. In case of newborn or fetus, umbilical artery. In either you can get from pre-placed arterial catheter or you can get the sample from directly puncture the artery. How will you collect by directly puncture the artery? First you locate the artery by palpation. Radial artery is superficial, you palpate from near the styloid process of the radius, and for 2 to 3 inches you palpate it, then you sterile the site and take a syringe with needle, small needle. How much syringe? How much capacity of the syringe? 5 cc. You have to arterial sample how much blood is needed? 3 cc. 3 cc blood is needed for analysis, and so you will get 5 cc syringe and small needle like 24 gauge needle. Then you palpate. Before, you have to make the syringe heparinized, not too much, not less. So what will we do? We take the syringe, draw a diluted heparin and rinse it and leave the rest. This heparin that will attach with the wall of the syringe will sufficient. Actually, if you not have heparinized, the blood will coagulate and the analyzer will not assess the blood gases. What analyzer? What is the name of the analyzer? Automated blood gas analyzer. Automated মানে তৈরি করা মেশিন আছে অটোমেটেড। যদি আরো sophisticated হয়, you can not only measure the blood gases, you can also measure the sodium, potassium, electrolytes, sodium, potassium, calcium, phosphate, magnesium. You can also measure that. Then you take care that the syringe does not contain the air bubble. Air bubble will prevent the analysis also. Less coagulant and much coagulant affect the analysis and also the air bubble. So we have to take some saline and left it. Then you directly puncture the radial artery, take 3 cc to 5 cc sample, and you have to measure within 15 minutes at room temperature. If your department has got the analyzer near the patient, you can directly send the sample to the automated analyzer. If you cannot send it, if you have to send to far distance, then you have to immerse the sample in the ice bag, and that is also you have to measure within 1 hour. Maximum you can measure the blood up to 1 hour. So accordingly you have to take that steps. Then you place the blood in a predetermined site of the analyzer, and it will give you the results. Huh? What are the complications of the taking arterial sample. It may cause pain, sometimes it may cause vasovagal attacks, it may cause hematoma, it may cause arterial injury, it may cause sometimes unsterile technique, you have done unsterile technique, then it may cause infection. Now, where we use this arterial blood gas? Mostly in critical patient, in critical unit, that is ICU, or sometimes in during major operations. So what are the parameters we measure in blood gases? Written in the board: pH, PCO2, PO2, bicarbonate, base deficit, base exit, anion gap, and SPO2. These are all measures at room temperature. These are the all values, the sample taken in the room temperature and room air. If the patient in ventilator and we determine FiO2, that is oxygen percentage, will go increase, the value will also be, particularly PO2 will also be increased. It will be more than 150, more than 200 in ventilator patient. But if you give oxygen through mask or nasal route, the value will increase. What are the normal values? pH is 7.35 to 7.45. PCO2 is 35 to 45 millimeter of mercury. PO2 is 80 to 100 millimeter of mercury. SPO2 is 95 to 100 percentage. These are PCO2 or PO2, the partial pressure in the arterial blood, partial pressure of the gases of the arterial pressure. And what is SPO2? This is the percentage, how percentage of the hemoglobin is saturated with oxygen. If it is more than 85, that is abnormal. Or if it is PO2 if it is more than 60, that is called hypoxemia. Now you will get the result. Well, how we will interpret? There are 7 or 8 steps to interpret the blood gas analysis. First, you see the pH. If it is low, this is acidosis. If it is high, this is alkalosis. That is more than 7.45 is alkalosis, less than 7.35 is acidosis. Now you determine whether it is acidosis or alkalosis. There may be 2 causes, either it is metabolic or it is respiratory. Then you look at the PCO2. If it is high, then it is respiratory acidosis. If it is low, then it is respiratory alkalosis. Okay? Then you look at the bicarbonate. If it is high, it is alkalosis. If it is low, it is alkalosis. Now it is metabolic alkalosis. If it is low, then it is metabolic acidosis. Then if it is acidosis and base or alkalosis, then you will get the result base deficit or base excess. How much bicarbonate is less, how much bicarbonate excess. That is called the base excess. Normal result is bicarbonate, normal value, measured value minus bicarbonate normal value. It is plus minus 2. That is normal. More than plus minus 2, that is acidosis or alkalosis. If it is respiratory, what happens? pH will be low, that is pH will be low and PCO2 will be high. This is normal. If it is respiratory alkalosis, what will happen? PCO2 will be low, pH will be high. Okay? Now metabolic acidosis. If it is metabolic acidosis, pH will be low, bicarbonate will be low. Both hand will be low. And if it is metabolic alkalosis, pH will be high, bicarbonate will be high. And if PO2 is less than 60 millimeter mercury, then it is called hypoxemia. It is called hypoxemia. And correspondingly, SpO2 will be less than 85%. If it is less than 85%, it is non-invasive. Rest is invasive. Now comes the question of whether it is compensated or uncompensated, whether it is partially compensated, whether it is fully compensated, whether it is uncompensated. If it is respiratory acidosis, compensation will be by the bicarbonate. If it is metabolic acidosis, then compensation will be by the PCO2. Then how will you determine whether it is compensation or not? Compensation always try to keep the pH normal or near normal level. This pH and PCO2 or bicarbonate will, in compensated acidosis or alkalosis, it tries to go in the opposite direction. That means pH low, PCO2 high, respiratory acidosis. Then what will happen to bicarbonate? It will also increase by kidney mechanism, renal mechanism. Okay? What are the conditions where you get this parameter abnormal parameter? Respiratory failure, respiratory causes, metabolic causes or circulatory causes. Respiratory causes, if it is acute, then it is acute exacerbation of asthma, bronchial asthma. If it is chronic, then it is either due to lung infection or due to COPD. I will coming to metabolic acidosis and alkalosis later. Now, what is anion gap? What is anion gap? Total number of anion minus total number of cation. Commonly, it is measured sodium minus chloride plus bicarbonate. Normal value is 8 to 12 millimeter mercury. What it measures? It measures unmeasured anion. Unmeasured anion in the blood, like ketoacidosis, lactic acidosis, these are the unmeasured. But this anion gap you have to correct according to the level of albumin. Albumin corrected anion gap, because albumin is the most prevalent anion in the body. Each gram of albumin decrease below 4 gram per 100 ml, you have to add pH 2.5. You have to add 2.5 to the pH. Then you will get the accurate pH. If albumin is normal, there is no issue of it. একটা ফর্মুলা আছে আমি ভুলে গেছি। তাহলে anion gap দিয়ে আমরা কি দেখি? What we see the anion gap? We see the unmeasured anion in the blood. What is the purpose of anion gap? It diagnoses the cause of metabolic acidosis. What are the two? There are two types of anion gap. One is nagma, one is hagma. Nagma is normal anion of metabolic acidosis. And hagma is high anion of metabolic acidosis. শুনিস নি? ওই জন্য হাসি পাচ্ছে তো, আমারও পাচ্ছে। Nagma and anion, hagma. Now what are the causes of normal anion gap metabolic acidosis? Normal anion gap means there is no unmeasured anion in the blood. It is due to the loss of bicarbonate from the kidney. Loss of bicarbonate from the kidney or GI system. তাহলে cause কি হতে পারে? One is renal diarrhea. Very good. First cause is diarrhea. Excellent. And what are the other causes of other GI causes? Loudly. Renal tubular acidosis. Good. And other cause? Intestinal fistula, gastric fistula, or stoma. That is colostomy stoma or ileostomy stoma. These are all probably all the causes of the nagma. Okay. Normal anion gap acidosis. Then you come high anion gap acidosis. এটার জন্য আমি খুললাম, এটাই আমার মনে থাকে না। The formula is mud piles. লেখ বড় বড় করে। আমি বড়টা লিখতে পারবো না, শুধু ফর্মুলাটা লিখে দিচ্ছি। बोलिए क्या क्या कॉज होता है? एम फॉर मिथेनॉल. वेरी गुड, यू आर वेरी गुड स्टूडेंट. দাদা এখানে ইয়ে আছে না, ইউ ফর ইউরেমিয়া, ডি ফর ডায়াবেটিক কিটোঅ্যাসিডোসিস. Oh, you know better than me. Then P for paralyte, I for overdose of iron or ironage. Okay. L for lactic acidosis. What are the causes of lactic acidosis? Where you will get lactic acidosis? Where there is deranged tissue perfusion. Where tissue perfusion means glucose is not converted into এই কোথা থেকে এলো দেবদূত? Sit down. I can see only your eyes. কোথায় কোথাও glucose glucose is not converted into energy or ATP. So body tries to get energy by anaerobic mechanism. That is the subject of physiology. So by anaerobic metabolism it produces lactic acid. What are the conditions? Shock, any type of shock, sepsis, severe septicemia, shock, hypovolemic shock. These are the conditions where body tries to get energy from anaerobic mechanism. পালিয়ে যায় কেন? তাহলে কত দূর অবধি হলো? এল হয়েছে। ইটা কি? হোয়াট ইজ ই? ইথিলিন, ইথানল না, ইথিলিন গ্লাইকল। আর লাস্ট এস স্যালিসাইলেট। ব্যাস, তোকে আর আমার কিছু পড়ানোর নেই। So the anion gap is necessary to narrow, to determine the causes of metabolic acidity. Only purpose to measure the unmeasured anion. To measure the unmeasured anion. Point out, measure but unmeasured anion. And you have to correct it for the albumin, serum albumin, if serum albumin is less than 4 gram 100 per 100 ml. If it is more than 4, there is no need to correct it. আচ্ছা, এবার তো এক কাজ কর, ওই অভ্র যেটা পাঠিয়েছে, try to open that and interpret it. मैम ओपन ग्रुप पे पार्टीशन। मैं छोड़ूंगी तो कोमली नहीं छोड़ेंगे, फाइनल एग्जाम में एक्सटर्नल आएगा वो नहीं छोड़ेंगे। ठीक है ना मैम? You read, open the group. Your CR has sent to ABG report and just read out. एक्सटर्नल एग्जाम तो आएगा बाहर से ना, कोई एम से आ सकता है, कोई रीम से आ सकता है, तो वो लोग तो नहीं छोड़ेंगे। वो एनाटॉमी फिजियोलॉजी के माफिक 70-80 सप्ली मिल जाएगा, तब क्या होगा? मम्मी डैडी को अच्छा नहीं लगेगा ना। तो you have got enough time to prepare yourself for the surgery. Ma'am, read out loudly. First report. আর লাস্টে কে এসছে নি? ওর আগে কে এসছে লাস্টে? হ্যাঁ, ওর আগে কে এসছে? কে এসছে ওর আগে? লাস্ট বা সেকেন্ড? এটা আমার খুলছে, তোদের খুলছে না? না, আমারও তো জিওর নেট, এই তো জিও। তোর 5G নেই? তাহলে এটা তো ওকে দে, তুই দীপশিকা ওকে দে, ওকে দে, ওই ম্যামকে দে। পর এটা কি আছে পর, মেজার্ড রিপোর্ট পর। আর আরে পড়লে তবে তো বুঝতে পারবি যে হাউ ক্যান ইউ ইন্টারপ্রেট whether it is compensated, whether it is acidosis, whether it is alkalosis, whether respiratory. pH may be normal or near normal in spite of there is acidosis or alkalosis. The normal pH does not mean there is no acidosis or alkalosis. So you have to find out whether there is compensation or not. Compensation is compensate the pH either by PCO2 or bicarbonate. Compensate the pH, and it will be in the opposite direction. The pH will be low, PCO2 or bicarbonate will be high. Always the opposite direction. এই গল্প করিস না দীপশিকা, তাহলে মাথা কিছু। কোন ফর্মুলাটা? anion gap, sodium minus chloride plus bicarbonate. Sometimes calcium is added, sometimes বাদিকে potassium is added. Normally international standard is sodium minus chloride plus bicarbonate. This normal values 8 to 12. Somebody says it is 8 to 16. কি পড়বি না আমি পড়বো? কে পড়বি? একজন উঠে দাঁড়া। ওই যে রিপোর্টটা পাঠিয়েছে, কে পড়বি? অ্যানালাইজ করতে হবে তো রিপোর্টটা। ওফ, তোদের নিয়ে আর পারা গেল না, আমি পড়ছি। চল, এটা লেখা আছে pH 7.4, ঠিক আছে? PCO2 54.8, PO2 77। আচ্ছা, বাই দা বাই, when PO2 will abnormal, when PCO2 will abnormal. PCO2 depends on mechanism of ventilation and PO2 depends on exchange at the arteriolar alveolar level. So what the cause will be different? What will be the causes of hypoxia? Either pulmonary edema or there is fibrosis in the lung. Or PCO2 abnormality may be in the mechanism of breathing, hyperventilation or hypoventilation. Hyperventilation or hypoventilation due to any cause, trauma, due to the problem of chest wall, due to the problem of diaphragm, due to the problem of gas exchange, due to the problem of less gas in the atmosphere. এখানে তারপর লেখা আছে PO2 77, সোডিয়াম 139, potassium 3.3, calcium 1.04, chloride 102, hematocrit 48%, glucose 153, lactate 1.1. Then pH is 7.42. That means it is near normal. It is near normal. But here is PCO2 is 54.8. This is abnormal, high. That means it is respiratory acidosis. PO2 is 77. It is also less than 80. Nearly normal. There is little amount of respiratory component. So this is respiratory acidosis. But there is no value of bicarbonate. No, there is bicarbonate. It's not measured by the machine. It is calculated by the machine from chloride, and so you will get the next line. Bicarbonate is 31.9. So it is increased towards the alkalosis point. So this is pH, what I told you before, that pH and PCO2 in compensation, pH and PCO2 will be in the, PCO2 or bicarbonate will be in the opposite diagnosis. If primary diagnosis is respiratory acidosis, then bicarbonate will try to increase to compensate the pH. pH will never come to normal. Either it will come to near normal, or if not compensated, uncompensated, it remains abnormal. So here you see the respiratory acidosis is trying to compensate by metabolic factor, that is bicarbonate. Okay? See very carefully the report. আমার মুখের দিকে তাকালে হবে না, রিপোর্টটা দেখ। আচ্ছা, এটা গেল প্রথম রিপোর্ট। SPO2 এখানে লেখা আছে 95, that means normal. PO2 little bit less, that is 77, near 80. আচ্ছা, পরেরটা কি আছে? Next report, what is next report? Next report is pH 7.44, that is normal. PCO2 57.4, that is abnormal. That means it is a respiratory acidosis. Again, it is a respiratory. Two different patients, but both with respiratory acidosis. And PO2 is 174. That means patient either in ventilation, or patient is getting nasal oxygen, or patient is getting oxygen through the mask. Otherwise, in room temperature, normal PO2 will be 8200. Because it is showing high normal, that means you suppose it is getting oxygen from outside source, more oxygen. That you can confirm. Here should be, there is a FiO2. Now how much percent FiO2 means how much percentage of oxygen you are giving. খোঁজো FiO2 আছে কিনা? আছে কি, আমি তো দেখতে পাচ্ছি না। ক্যালসিয়াম FiO2 আছে সবচেয়ে উপরে, হ্যাঁ এই তো সবচেয়ে উপরে। বাহ, FiO2 হচ্ছে 21%, 21%, not room air, but 21%. It is মানে ভেরি লেস, একদম সবটাই উপরে আছে। Patient temperature 37, মানে normal. That means here is bicarbonate is 34.8. It is also tries to compensate the respiratory acids. Then what are the indication of blood gas analysis? Respiratory failure, circulatory failure, main heading. Respiratory failure, circulatory failure, metabolic derangement. Metabolic derangement. These are the main heading. Then there are so many causes will come in each heading. Circulatory failure means heart failure due to coronary artery disease, due to pericardial effusion, due to cardiac tamponade, due to valvular disease. Respiratory failure will come into bronchial asthma, COPD, infection, septicemia, septic shock, diabetic ketoacidosis, lactic acidosis, and other med piles I have. What are the types of respiratory failure? Type 1, type 2. Type 1, in type 1, what will we get? This is due to hypoxemia. And type 2 is due to increased PCO2. Failure of mechanical ventilation. তো একটা লিঙ্ক পাঠালাম, হ্যাঁ, গ্রুপে শেয়ার করে দিস। ফ্লো চার্ট আছে, গ্রুপে শেয়ার করে দিস, ফ্লো চার্ট আছে, মানে হাউ ইউনিট ম্যানেজ ব্লাড গ্যাস ইন ক্রিটিক্যাল কেয়ার। ওটা খাতায়, ওটা থেকে দেখে খাতায় ভালো করে এঁকে দিবি। পেয়েছিস? ঢুকেছে? ব্যাস, গ্রুপে দিয়ে দে, সবাই ওই ইয়ে করে দিবি। ঠিক আছে? আর কিছু প্রশ্ন আছে? মাথায় ঢুকেছে কিছু? পরীক্ষা লাগবে তো এগুলো। কারো কারো কিছু কোশ্চেন আছে? এনি কোশ্চেন? ম্যাম, আস্ক কোশ্চেন। কোশ্চেন করলে তবে বোঝা যাবে যে। আচ্ছা, পরের সপ্তাহে যদি চন্দ্রনাথ ম্যানেজকে ফোন করবি, যদি নেয় স্যার, নাহলে আমি নেবো। পরে এরপরে কি পড়বি? আর কি বাকি আছে তোদের? জানি না তো, সবই আছে। ইনস্ট্রুমেন্ট কি স্যার পড়াবে? হ্যাঁ, না আমি কি কিছু পড়াবো ইনস্ট্রুমেন্ট? এসজিডিতে হার্নিয়া হাইড্রোসিল আউটডোরে ইনস্ট্রুমেন্ট আছে, স্পেসিমেন আছে। ঠিক আছে, নেক্সট দিন প্রবলেম, নাহলে একটা এনি অপারেটিভ স্টেপস করবো, যেটা ও পড়ায়নি আর কি।